Hi, Dr. Raad. Can you share a bit about Rivia Medical?
Yeah, sure. So we are a group mental health practice. We see a wide variety of people with mental health problems of various sorts. We're a group that has right now two psychiatrists and six nurse practitioners and a social worker. So we do you know, medication management, psychotherapy, a few other things as well, like biofeedback. We're rolling out neuropsychological assessments. We try to offer uh, some gamut of treatment options to depending on what each individual needs.
Wonderful. And what are some of the common challenges that people come to see you for?
Yeah, so some really common ones are depression, anxiety, various kinds of anxiety troubles. Um, I would say obsessive compulsive disorder, PTSD, ADHD or attention deficit disorder. We also see people who are coming with problems in their relationships, whether it's with their romantic relationships or family or other people, problems of various sorts with work, inability to get um, as far in their work or career as they would like, and for some psychological reason, as well as people coming to us wanting to explore their lives and get into therapy of some sort.
And can patients see you for just medication management, just therapy, and also both?
Absolutely. Yeah, I would say most people come wanting, in addition to medication management, some form of therapy. Um, and so most people will see for therapy. Quite a few will be for medication management as well, and some for medication management alone.
And
Mhm.
what does the intake process look like? Can you share a bit about what that process looks like?
Yeah. So you're scheduled for an appointment with one of our clinicians, depending on what you're asking for, and depending on what your particular problems are. And often, I think, just because of the number of people that we have of each sort, most likely that is a nurse practitioner at first. But then in the course of, so you meet for an evaluation session or two, or sometimes more, depending on the complexity of the story. We like to take our time and get through the story, even if it's more than one session. And sometimes in that first session, you'll also meet for a few minutes with one of the psychiatrists who'll check in and offer another perspective as well. And then, after a couple of sessions, you'll have then a conversation about our impressions and what we recommend for treatment.
And what
Mhm.
is your practice philosophy?
We have a few elements to our philosophy. We like to offer a holistic perspective on all cases, so taking various perspectives into consideration, including biological, psychological, cultural perspectives. And so we like to do a thorough evaluation because that's how we get all this information and put it together. And we like to always incorporate um, medications with other treatments that are necessary.
Can you tell us about biofeedback and neurofeedback?
Yeah. So biofeedback and neurofeedback are one of the treatment modalities that we offer. It's a method of improving self-regulation and managing your emotional states or attention. And what it does is you have sensors that you wear on the scalp that track particular commonly known brain waves that tend to correlate with anxiety or with attention. And then someone sets you up with those, and then you watch a screen. You might watch a movie, you might watch a pre um, developed screen video. It could be a video of like a nature scene or something like that, depending on your preference and also the situation. And you do that on a regular basis, and the screen helps you develop certain capabilities. So it's useful for a variety of conditions. It tends to have the best evidence for attention deficit disorder and troubles with attention, but it also can be used for anxiety, for insomnia, for depression, for other um, troubles that have to do with improving self-regulation.
And Dr. Rad, do you have a message for patients who might be considering starting medications or starting therapy?
it's always a good idea to get an evaluation and find out what someone can offer you, and then you can make a decision about how you want to proceed.
Great. Thank you so much.